Question 1. A 65-year-old patient with chronic kidney disease, receiving IV gentamicin for a severe urinary tract infection, begins reporting persistent ringing in both ears and difficulty hearing. What is the nurse's best immediate action? A. Document the finding and continue monitoring. B. Notify the healthcare provider immediately. C. Administer acetaminophen for discomfort. D. Reassure the patient and encourage fluid intake. Answer. B. Notify the healthcare provider immediately. Rationale. Tinnitus is an early indicator of ototoxicity, a known adverse effect of aminoglycosides like gentamicin. Patients with renal impairment are at higher risk for accumulation and toxicity. Prompt provider notification is critical to prevent irreversible hearing loss. Question 2. A patient receiving long-term warfarin therapy presents with sudden epigastric pain and dark, coffee ground emesis. What is the nurse's priority intervention? A. Offer oral fluids and observe for additional symptoms. B. Notify the healthcare provider and prepare for reversal therapy. C. Administer a proton pump inhibitor. D. Document the findings and reassess in 30 minutes. Answer. B. Notify the healthcare provider and prepare for reversal therapy. Rationale. Coffee ground emesis suggests upper GI bleeding, a life-threatening complication of warfarin therapy. Immediate action is necessary to stop the bleeding and reverse the anticoagulant effect using vitamin K or fresh frozen plasma. Question 3. A newly diagnosed type 2 diabetic patient started on metformin reports malaise, rapid breathing, and abdominal discomfort. Which of the following side effects is most concerning? A. Nausea and metallic taste. B. Weight loss and anorexia. C. Lactic acidosis symptoms. D. Flatulence and bloating. Answer. C. Lactic acidosis symptoms. Rationale. The symptoms described are classic signs of lactic acidosis, a rare but fatal side effect of metformin. This condition requires immediate discontinuation of the drug and urgent medical evaluation. Question 4. A nurse is monitoring a postoperative patient receiving IV morphine every 2 hours for pain management. The patient's respiratory rate drops to 8 breaths per min. What should the nurse do first? A. Reduce the morphine dose for the next administration. B. Elevate the head of the bed and encourage deep breathing. C. Administer naloxone as prescribed and notify the provider. D. Continue monitoring until the next dose is due. Answer. C. Administer naloxone as prescribed and notify the provider. Rationale. A respiratory rate of 8 per min indicates opioid-induced respiratory depression, which is life-threatening. Naloxone is the antidote to reverse this effect immediately. Question 5. A psychiatric patient stabilized on lithium reports new onset of excessive thirst, hand tremors, and frequent urination. Which lab result is most critical to assess? A. Blood glucose level. B. Serum lithium level. C. Serum creatinine. D. Liver function tests. Answer. B. Serum lithium level. Rationale. These symptoms are classic signs of lithium toxicity. Monitoring the serum lithium level is critical, especially in patients with renal dysfunction, as impaired excretion can lead to toxicity. Question 6. A patient taking clozapine for schizophrenia reports sore throat and fever. The nurse reviews the latest CBC and finds WBC count of 2,500 per cubic millimeter. What is the most appropriate nursing action? A. Encourage fluid intake and recheck labs in 24 hours. B. Continue the medication and monitor for worsening symptoms. C. Discontinue clozapine and contact the provider immediately. D. Administer antipyretic medication and reassess later. Answer. C. Discontinue clozapine and contact the provider immediately. Rationale. A WBC count below 3,000 per millimeter and symptoms of infection suggest agranulocytosis, a life-threatening adverse effect of clozapine. Immediate discontinuation and isolation are required. Question 7. A hypertensive patient prescribed enalapril complains of a persistent, dry cough that has lasted for weeks. What is the best nursing response? A. Suggest throat lozenges and hydration. B. Inform the patient that this is expected and will pass. C. Notify the provider to consider switching to an ARB. D. Recommend discontinuation of the medication without consulting the provider. Answer. C. Notify the provider to consider switching to an ARB. Rationale. A dry cough is a well-known side effect of ACE inhibitors, like enalapril, due to bradykinin buildup. Switching to an ARB is often the solution. Question 8. A patient on long-term phenytoin therapy presents with swollen, bleeding gums. Which nursing action is most appropriate? A. Encourage the patient to floss daily. B. Instruct the patient to use a soft bristle toothbrush and inform the provider. C. Increase the phenytoin dose to achieve better seizure control. D. Reassure the patient this is temporary. Answer. B. Instruct the patient to use a soft bristle toothbrush and inform the provider. Rationale. Gingival hyperplasia is a common chronic side effect of phenytoin. Good oral hygiene and regular dental visits are essential. Dose adjustment may not affect this side effect. Question 9. An older adult patient taking digoxin reports blurred vision and seeing yellow halos around lights. Which additional finding would support suspected digoxin toxicity? A. Heart rate of 120 bpm. B. Blood pressure of 160 over 90 millimeters of mercury. C. Serum potassium of 2.9 milliequivalent per liter. D. Blood glucose of 110 milligram per deciliter. Answer. C. Serum potassium of 2.9 milliequivalent per liter. Rationale. Hypokalemia enhances digoxin toxicity. Yellow vision, bradycardia, and GI upset are all classic signs. Potassium must be corrected and digoxin level assessed. Question 10. A heart failure patient receiving IV furosemide is being monitored for electrolyte imbalance. Which finding would require immediate action? A. Potassium 3.1 milliequivalent per liter. B. Sodium 138 milliequivalent per liter. C. Calcium 9.0 milligram per deciliter. D. Magnesium 2.0 milligram per deciliter. Answer. A. Potassium 3.1 milliequivalent per liter. Rationale. Furosemide can cause severe hypokalemia, increasing the risk of arrhythmias. Prompt potassium replacement is needed. The other levels are within acceptable range. Question 11. A patient taking carbamazepine for seizure control reports fever and fatigue. Labs show WBC of 2,800 per cubic millimeter. What is the nurse's immediate action? A. Withhold the next dose and notify the provider. B. Document findings and continue therapy. C. Encourage fluids and rest. D. Administer leukopoietic agents. Answer. A. Withhold the next dose and notify the provider. Rationale. Carbamazepine can cause bone marrow suppression. A low WBC places the patient at risk for infection and warrants discontinuation. Question 12. A patient on simvastatin reports muscle pain and dark-colored urine. What lab should the nurse check first? A. Serum potassium. B. Creatine kinase CK level. C. ALT/AST. D. White blood cell count. Answer. B. Creatine kinase CK level. Rationale. These are signs of rhabdomyolysis, a serious complication of statin therapy. CK levels help confirm muscle breakdown and risk of renal failure. Question 13. A patient with rheumatoid arthritis taking prednisone long-term presents with weight gain, facial swelling, and purple abdominal striae. What is the most likely explanation? A. Thyroid dysfunction. B. Addison's disease. C. Cushingoid effects from prednisone. D. Inadequate steroid dose. Answer: C. Cushingoid effects from prednisone. Rationale: chronic corticosteroid use can lead to Cushing's syndrome symptoms like moon face, central obesity, and skin changes. Question 14. A tuberculosis patient on isoniazid reports numbness and tingling in the hands and feet. What should the nurse anticipate next? A. Discontinue the medication. B. Administer vitamin B6 supplementation. C. Lower the dose of isoniazid. D. Increase protein intake. Answer: B. Administer vitamin B6 supplementation. Rationale: peripheral neuropathy is a known side effect of isoniazid due to B6 deficiency. Supplementing with pyridoxine prevents or reverses this effect. Question 15. A cardiac patient receiving transdermal nitroglycerin reports a pounding headache. What is the best nursing action? A. Remove the patch immediately. B. Administer PRN acetaminophen. C. Stop all nitrate medications. D. Increase fluid intake. Answer: B. Administer PRN acetaminophen. Rationale: headache is a common side effect of vasodilation. It's not an indication to stop therapy unless severe or persistent. Question 16. A patient receiving linezolid for MRSA infection presents with bruising and a platelet count of 90,000 per cubic millimeter. What is the priority action? A. Continue therapy and monitor for bleeding. B. Notify the provider and hold the next dose. C. Start IV fluids and repeat labs. D. Administer platelet transfusion. Answer: B. Notify the provider and hold the next dose. Rationale: thrombocytopenia is a serious side effect of linezolid. Risk of bleeding increases, and therapy may need to be stopped. Question 17. A 70-year-old patient started on ciprofloxacin complains of sudden heel pain and swelling. What should the nurse do first? A. Encourage ambulation. B. Reassure the patient this is common. C. Withhold the next dose and notify the provider. D. Apply a heating pad. Answer: C. Withhold the next dose and notify the provider. Rationale: Achilles tendon rupture is a serious and known risk with fluoroquinolones, especially in older adults. Drug should be stopped immediately. Question 18. A patient on lisinopril has a BP of 88/56 millimeters of mercury before the scheduled dose. What is the most appropriate action? A. Administer the dose and reassess BP later. B. Hold the dose and notify the provider. C. Administer half the dose. D. Give a fluid bolus first. Answer: B. Hold the dose and notify the provider. Rationale: ACE inhibitors can cause hypotension. A BP of 88/56 is low, and giving the drug may worsen it. Hold and consult the provider. Question 19. A patient on continuous heparin infusion develops new-onset petechiae, and platelets drop to 68,000 per cubic millimeter. What should the nurse do first? A. Decrease the infusion rate. B. Discontinue heparin immediately. C. Administer protamine sulfate. D. Monitor the patient closely. Answer: B. Discontinue heparin immediately. Rationale: these are signs of heparin-induced thrombocytopenia, HIT, a serious immune-mediated condition. Stopping heparin is the priority. Question 20. A patient on long-term amiodarone develops persistent dry cough and exertional dyspnea. What is the nurse's best response? A. Encourage coughing exercises. B. Administer bronchodilators. C. Notify the provider and hold further doses. D. Apply oxygen and wait. Answer: C. Notify the provider and hold further doses. Rationale: amiodarone-induced pulmonary toxicity can present with respiratory symptoms. This is a serious complication requiring discontinuation and further evaluation. Question 21. A patient with atrial fibrillation on dabigatran presents with new-onset hematuria and a blood pressure of 86/54 millimeters of mercury. What is the nurse's priority action? A. Check the most recent INR. B. Withhold the next dose and notify the provider. C. Administer vitamin K. D. Start IV fluids and continue the medication. Answer: B. Withhold the next dose and notify the provider. Rationale: dabigatran increases bleeding risk. Hematuria with hypotension may indicate internal bleeding. Unlike warfarin, vitamin K is not effective. Immediate provider notification is necessary. Question 22. A nurse is caring for a child with leukemia receiving vincristine IV. The child reports foot drop and inability to button a shirt. What is the most appropriate nursing action? A. Suggest physical therapy exercises. B. Administer PRN acetaminophen. C. Notify the provider immediately. D. Reassure the child this is expected. Answer: C. Notify the provider immediately. Rationale: vincristine is neurotoxic. Peripheral neuropathy and motor dysfunction, like foot drop, are serious and may require dose adjustment or discontinuation. Question 23. A patient taking spironolactone for heart failure presents with ECG changes and a potassium level of 6.2 milliequivalent per liter. What action should the nurse take first? A. Prepare to administer IV calcium gluconate. B. Encourage oral fluids. C. Continue the medication and monitor ECG. D. Notify the provider and hold the next dose. Answer: D. Notify the provider and hold the next dose. Rationale: spironolactone is potassium sparing. Hyperkalemia is dangerous and requires withholding the drug and notifying the provider. Calcium gluconate may be used, but only with provider order. Question 24. A patient prescribed methotrexate for rheumatoid arthritis reports mouth sores and fatigue. What should the nurse assess next? A. Platelet count. B. INR. C. Creatinine clearance. D. Calcium level. Answer: A. Platelet count. Rationale: methotrexate is myelosuppressive and can cause thrombocytopenia, leading to oral ulcers and fatigue. CBC monitoring is essential. Question 25. A diabetic patient is prescribed beta blocker propranolol. What side effect might mask signs of hypoglycemia? A. Tachycardia. B. Sweating. C. Tremors. D. Palpitations. Answer: A. Tachycardia. Rationale: beta blockers like propranolol blunt sympathetic responses, especially tachycardia, making hypoglycemia harder to detect. Sweating may still occur due to cholinergic effects. Question 26. A patient on hydralazine for severe hypertension develops fever, joint pain, and a positive ANA test. What adverse effect should the nurse suspect? A. Acute infection. B. Drug-induced lupus. C. Rheumatoid arthritis. D. Serum sickness. Answer: B. Drug-induced lupus. Rationale: hydralazine can cause lupus-like syndrome, especially at higher doses. Symptoms mimic SLE and resolve upon discontinuation. Question 27. A patient receiving amphotericin B complains of chills, fever, and rigors during infusion. What is the nurse's priority action? A. Discontinue the infusion immediately. B. Slow the infusion rate and administer acetaminophen. C. Increase the IV rate to flush the medication. D. Reassure the patient and continue as ordered. Answer: B. Slow the infusion rate and administer acetaminophen. Rationale: amphotericin B often causes infusion reactions. Pre-medication and slowing the infusion rate help reduce symptoms. Stopping it is not always necessary unless severe. Question 28. A patient started on sertraline reports new onset suicidal thoughts and agitation after 5 days of therapy. What is the nurse's best response? A. Encourage journaling. B. Educate that side effects are temporary. C. Contact the provider immediately. D. Discontinue the drug without provider input. Answer: C. Contact the provider immediately. Rationale: SSRIs like sertraline may increase suicidal thoughts early in treatment, especially in younger patients. This is a serious adverse effect requiring immediate provider intervention. Question 29. A nurse administers IV vancomycin too rapidly. The patient develops flushing and hypotension. What is the most likely cause? A. Allergic reaction. B. Anaphylaxis. C. Red man syndrome. D. Sepsis. Answer: C. Red man syndrome. Rationale: rapid vancomycin infusion can cause histamine release, leading to flushing and hypotension. Slowing the rate prevents this reaction. It is not a true allergy. Question 30. A patient taking levothyroxine for hypothyroidism reports restlessness, heat intolerance, and palpitations. What is the most appropriate nursing action? A. Withhold the dose and notify the provider. B. Reassure the patient this is common. C. Administer a beta blocker. D. Encourage relaxation techniques. Answer: A. Withhold the dose and notify the provider. Rationale: these are symptoms of thyrotoxicosis, indicating possible overdosage of levothyroxine. Dose adjustment is necessary. Question 31. A patient on isosorbide mononitrate reports lightheadedness and dizziness when getting out of bed. What is the best explanation for this symptom? A. Rebound hypertension. B. Orthostatic hypotension. C. Hyperkalemia. D. Fluid overload. Answer: B. Orthostatic hypotension. Rationale: nitrates cause vasodilation and may lead to orthostatic hypotension. Educating the patient on slow position changes is critical. Question 32. A patient receiving epoetin alpha for anemia secondary to chronic kidney disease suddenly develops a BP of 190/110 millimeters of mercury and headache. What is the nurse's immediate concern? A. Risk for stroke due to hypertension. B. Medication is ineffective. C. Dehydration from anemia. D. Medication-induced bradycardia. Answer: A. Risk for stroke due to hypertension. Rationale: epoetin alpha can cause severe hypertension, especially if hematocrit rises rapidly. The nurse must assess for hypertensive crisis and notify the provider. Question 33. A patient taking amitriptyline complains of dry mouth, blurred vision, and urinary retention. What is the cause of these symptoms? A. Anticholinergic effects. B. Renal failure. C. Dehydration. D. Hypertension. Answer: A. Anticholinergic effects. Rationale: tricyclic antidepressants like amitriptyline have strong anticholinergic effects, which can be uncomfortable or dangerous in older adults. Question 34. A patient started on captopril for hypertension develops facial swelling and difficulty breathing. What is the nurse's priority action? A. Apply oxygen. B. Administer diphenhydramine. C. Notify the provider and prepare for emergency care. D. Reassure the patient. Answer: C. Notify the provider and prepare for emergency care. Rationale: angioedema is a life-threatening adverse effect of ACE inhibitors. Airway management may be needed. Immediate action is critical. Question 35. A patient taking rifampin for tuberculosis is concerned about reddish-orange urine. What is the nurse's best response? A. This may indicate kidney failure. B. You need to increase fluid intake. C. This is a harmless and expected side effect. D. Stop the drug immediately and notify your provider. Answer: C. This is a harmless and expected side effect. Rationale: rifampin causes orange discoloration of body fluids, which is benign and should be explained to the patient to avoid unnecessary alarm. Question 36. A patient receiving IV potassium chloride complains of a burning sensation at the IV site. What is the nurse's priority action? A. Stop the infusion and remove the IV. B. Continue and apply a warm compress. C. Notify the provider immediately. D. Dilute the solution further. Answer: A. Stop the infusion and remove the IV. Rationale: burning at the site can indicate infiltration or phlebitis, which is dangerous with KCl. Stop infusion to prevent tissue damage. Question 37. A patient taking levodopa/carbidopa for Parkinson's disease reports involuntary movements of the face and limbs. What is the most likely explanation? A. Drug withdrawal. B. Parkinson's disease progression. C. Dopaminergic dyskinesia. D. Hypoglycemia. Answer: C. Dopaminergic dyskinesia. Rationale: long-term use of levodopa can lead to dyskinesias. These movements reflect peak dopamine levels and may require dose adjustment. Question 38. A nurse administers naloxone to a patient with opioid overdose. The patient awakens but becomes agitated and reports severe pain. What is the nurse's best response? A. Restrain the patient. B. Give another dose of naloxone. C. Monitor and provide pain management as ordered. D. Administer morphine. Answer: C. Monitor and provide pain management as ordered. Rationale: naloxone reverses analgesia. After opioid reversal, patients may become agitated and require reassessment for pain control. Question 39. A patient with bipolar disorder is started on valproic acid. Which lab value should the nurse monitor closely? A. Potassium. B. Liver enzymes. C. WBC count. D. Creatinine. Answer: B. Liver enzymes. Rationale: valproic acid can cause hepatotoxicity. Regular monitoring of ALT and AST is required to detect early liver damage. Question 40. A patient on clopidogrel for stroke prevention is scheduled for an elective surgery. What is the nurse's priority action? A. Document medication history. B. Check PT or INR. C. Notify the surgeon about recent antiplatelet use. D. Instruct the patient to take the dose on the day of surgery. Answer: C. Notify the surgeon about recent antiplatelet use. Rationale: clopidogrel increases bleeding risk. It should be stopped several days before surgery, and the surgical team must be informed for safety planning. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.